All right, just another couple minutes and then we'll get started. And I'll formally name this, but if folks do want to start breaking some ice and getting acquainted in the chat, you can feel free to share your organization, your role, where you're located, your pronouns if you'd like. And that way folks can get to know each other in the chat a bit, because typically these groups are a little too large for round robin real-time introductions. So we want folks to have an opportunity to share who they are and where they're from and what they do. So please feel free to do so in the chat. I'm just going to give it another minute, and then I'm sure folks will continue to trickle in, but just for the sake of time, because we don't have too much of it in these sessions, we do want to get started. So, and thank you, Amanda, for starting with that breaking of the ice. Folks, again, please feel free to introduce yourselves in the chat. Where are you from? What role are you in? Um, and what organization you represent, or organizations if there are multiple. All right, welcome, friends. Thank you to folks who are introducing themselves in the chat. That's awesome. And it is 5 after the hour, so I imagine more folks will be rolling in across this time, but we do want to get started to make sure we fit in all of the wonderful things that we have planned for today. Again, welcome to today's NTAC session. This is our youth and young adult support space, otherwise known as our YYASS. So we're really, really grateful, as always, that you're taking time out of your busy schedules to join us. And as always, we have our intro bits, right? Starting with this disclaimer. So this presentation was prepared by NTAC under a cooperative agreement from SAMHSA. And while this event is supported by SAMHSA, the contents are those of the authors and do not necessarily represent the official views of SAMHSA, HHS, or the US government. And then in terms of security issues, seems like we've been in the clear so far. But in the event that there are any security issues that come up for today, this session will immediately end. Zoom space will close, and you will be notified by email on how to rejoin a new session. We always want to give creds where they're due to all involved in making this wonderful space happen. So listed here are all of our incredible partners that have come together to really utilize their expertise, and their subject matter knowledge to help inform this field by creating products, resources, and sessions like this one to enhance the behavioral and mental health fields, as well as other youth serving systems and fields even outside of that, right? And as a center at NTAC, right, our vision is that all children, youth, and families living with and impacted by mental health experiences will have access to resources and opportunities that they need to thrive in a comprehensive and equitable system of care. We serve a wide cross-sector audience, right, across age ranges, demographics, systems, including everyone from state leaders to providers to the school workforce, infant and early childhood providers, community-based providers, peer supports, right? Family partners, youth partners, and much more. And in terms of the support that we provide or resources that we offer, that is also very broad, right? Individual consultation is a part of it, but also more in-depth sessions like the one that we're offering right now, to peer learning exchanges and other available tools and resources. And our aim is really to create those outlets for communication, collaboration, and resource sharing amongst all of us, right? And please also make sure to check out all of our resources and archived presentations on our website. And you can also go to the Contact Us link there to request consultation or training. So, oh, thank you. Beat me to it, Bridget. Okay, so just some commonly asked questions that we want to make sure we provide the answers to if maybe you're new to this space. So in the follow-up email for today's session, you will receive a certificate of completion, a link to the recording of this session. This session will be recorded, as folks I'm sure are aware of, right? And a copy of this slide deck presentation that is being shown if you haven't received it already. So Again, where are we? What is this virtual space? This is our youth and young adult support space, or our YYASS, which is a monthly virtual learning space for those who are working in and leading, again, youth-centered programs and organizations to come together, learn together, share resources with each other. And this is a perfect space for leaders of Youth Move chapters. I am from Youth Move National, so got to plug our chapter network, but also other youth-run programs that engage youth with lived mental health, or other youth serving system experience in meaningful change making. So really, we welcome conversations and networking between all of us, as well as invite presenters to share about particular topics that are of importance or prominent across conversations within this workforce as well. So we've already gotten through a bit of this agenda, right? We've done our welcome and sign in, and folks have been continuing to introduce themselves in the chat. I appreciate that. I believe that we've gone through all of our disclaimers and intro bits. So now I just want to put a little bit more context to who I am in this space if you're new here before introducing and passing the virtual mic over to our presenter. So for those who are new here, need a reminder, my name is Shane McDonald. My pronouns are they, them, and theirs. I am formally a youth program coordinator with a national nonprofit called Youth Move National. I also work in partnership with NTAC, and part of that partnership work is that I am your YAS host. I will also share, as always, that I am a person of many lived and living experiences and identities. And I'm just so grateful to be doing the work that I do and to be sharing this space with all of you. And what I'm more excited about, because I'm always here, is to introduce our presenter for today. So for today's session, we are joined by the wonderful Michael Durchslag, an Association of Recovery School Board Chair, who will be discussing the importance of recovery high schools and the essential role that they play in supporting adolescents through substance use addiction and recovery, and also provide some important resources that could potentially help support recovery high schools that are local to your areas. So thank you so much for joining us today, Michael. And I am graciously passing this virtual mic over to you.
Well, thank you, Shane, and thank you for just having me here today and being here today. So my name is Mike Durchslag, and I think I do have a slide show that will be put up. Yep, there we go. And it's the title. This is Adolescent Substance Misuse and Recovery High Schools. My name is Mike Durchslag. My pronouns are he, him, his, and I am the director of Peace Academy, which is an acronym for Peers Enjoying a Sober Education. We're the oldest recovery school in the country. I probably should say longest running. We weren't the first, but we started in January of 1989. I've actually been involved with them since 1995. I taught social studies here for about 11 years, and then January of '07, that's when I became the director. Um, and so I've been in that role ever since. So I am really committed to adolescent wellness and helping them move forward in their lives, specifically students who suffer from substance misuse and negative consequences around that. Over 90% of our students, if not more, do suffer from co-occurring diagnoses. And so as we get better as a field, we just are better able to kind of serve the whole student. My the I also get to serve as the Association of Recovery Schools Board Chair. I've been associated with ARS since 2015, and in January of 23 is when I became the board chair. I also started a nonprofit to help support the school because most recovery schools are pretty small. And through that role, not only do we support the school, but I opened up Minnesota's first alternative peer group, or APG, which is another form of recovery supports for adolescents that kind of goes beyond our school, but can serve more adolescents in the metro area that we serve. And so why are supports like these needed? Well, one, you can see it here, and I'm not going to go about it, but it's just like when we think about an adolescent or a young person who's trying to change the trajectory of their lives, to do so is very difficult in their traditional settings. And the more we know about brain chemistry, know that that's true because their friends who are not bad people, but they're just used to interacting with that individual in a certain way. And oftentimes that is in risky behaviors, especially substance use. And that individual is also kind of wired to do the same. And so when they see their friends It takes an awful lot of willpower to say no, and we're way beyond the Nancy Reagan "just say no" era was a part of. So, according to the National Institute of Drug Abuse, you can see that those students high school students who complete treatment, over 97% of them are offered drugs the first day returning. And even more importantly, like the staff that are in these schools, and again, it's not a knock on the staff. There is no need for them to get any kind of specialized training to serve youth who are in early stages of recovery. They don't understand the gaps of education. They don't understand cravings, and they really don't need to. And it's not just the teachers, but school personnel across the board. Um, Specific substance misuse trainings is not a necessity. And if it is, it's just very minimal about what drugs are and what they can do to a person, but there's nothing about how to support youth who are in those early stages of recovery. And very little schools have mental health professionals. And lastly, I'll just say that peers, we know that the peers that are the most important person in any person's life, young person's life. I can be the best father out there, and I'm not. I'm probably, maybe top 20. But my kids' friends who are the biggest influence. You can see the trajectory of the kind of recovery high schools. They're very difficult to open, to be honest, and the average um, uh, length of being open is about 9 years. We're hoping to increase that. But because the ebb and flow of students coming and going, and transportation is a huge barrier, it is not, because we're responsible not only for recovery sports, but also the education and everything that goes along with that. But you can see that we've been kind of growing. And today we have about 45 recovery high schools across the country. Next slide. Um, and you can see there's large swaths of area that young people do not have access to kind of meaningful recovery supports. Minnesota, Texas, Massachusetts and now Florida have large concentrations of recovery high schools, and because of that, when you think of the 45 and you take those states out of them, they're very few and far between. I had a friend and a colleague who once said, if we were to ask an adult who's coming out of treatment to go spend 6.5 hours a day, 5 days a week in their favorite bar, but don't drink, and go to a 12-step meeting afterwards, we would think that would be the worst kind of recovery plan ever. But that's, in a very real way, that's what young people are asked to do every single day when they come out of treatment. And recovery schools, since I brought up 12 steps, I will say that recovery high schools across the board support multiple pathways in recovery. And when we talk about broader ways of supporting recovery in the schools in general, that includes more of a harm reduction model as well. So just since I brought up 12 steps, I just want to make sure that everybody understands that we do support across the board multiple pathways. Next slide, please. So what is a recovery high school? Recovery high school's primary purpose is to educate students. We are schools first. We're not treatment centers. We're not aftercare programs. Sometimes, depending on the recovery or the treatment landscape, we may be providing those initial engagements in recovery, because there might not be anything else for that young person. But we are school. We're school first. We tend to, when we first open, and kind of how we're supposed to kind of set up to operate, we are part of the continuum of care post treatment, not in the place of treatment. But like I said, as we see more and more adolescent substance use treatments being closed nationally, we still have to provide young people services. And so different programs have different plans in place and are kind of adjusting for the needs. But we still are best set up for students who are just kind of who've already initially engaged in treatment into that recovery process, and then help support them as move forward. And sometimes that is helping them move through the stages of change to get to that place. We provide additional supports through professional and specifically trained staff. For example, my teachers have been trained frequently about kind of different gaps in education, how physiologically recovery times it can be, and so how the brain needs to kind of get back up to speed, not to mention kind of the transitional or transitory state of our students, how they've gone to many, many schools before coming to us, and there's going to be gaps of education there. So how to meet those gaps. And also we're restorative practice communities almost across the boards as part of our accreditation process. So really kind of very responsive, trauma informed, restorative schools. So we really make sure that our staff aren't further traumatizing students, and provide them safe space to kind of grow as individuals and be who were meant to be, or learn who that's supposed to be. community. Um, we also try to meet. We always try to. I'm sorry. We also have recovery support staff. You know, my school has a licensed alcohol and drug counselor. We have peer recovery specialists. So they're trained specific recovery staff in the communities too. Some schools are also able to bring in mental health providers. We contract that out and resource out, try to meet the whole students. We do meet specific state requirements for awarding secondary diplomas, and that's important. That we are schools, and we want our students not only to stay engaged in their recovery, but we want them to get their diploma. And we also hope to transition to the next phase of post-secondary enrollment as well. Next slide, please. And the idea is that all students will be enrolled in recovery from substance use or co-occurring by the students. And so schools are able to, and students are able to kind of meet where each other's are. And we're really available to any student. So you don't have to be from a specific program, but it's just as any student that meets the requirements of the state or the district or even the school, they should be able to access a recovery high school. And so that's the difference between us and maybe a school that's connected to a treatment center. That a treatment center who might have a school a part of it, you have to be a part of that treatment center to be a part of that school. We're open to pretty much everybody as there is. Next slide, please. And I know I'm talking super fast, and hopefully there'll be time for questions. So recovery high schools, we have trained, experienced teaching staff. I've already mentioned. We have licensed alcohol and drug counselor. We try, since many of our students are transitional, like they sometimes experience homelessness, move around a lot. We have a social worker, which also can connect them to mental health practitioners. We do bring in outside mental health practitioners. We have peer recovery specialists, and we have the peers. You know, our school is Peers Enjoying a Sober Education. It was named by the students themselves back in 1989 because they understood, one is that they're the first place that they ever felt at peace, so that's why we're P's. But it's really the peers who are the most important aspect in their lives, because they need to make new friends, so that understand what it means to be a young person in recovery, or trying to actively change the trajectory of their lives, who understand about the hardships of going to a party where there might be substance use, how obsession of mind can kind of kick in weeks later, and self-pity, and just all these feelings, emotions, and also identify in the mental health capacity, that it's common for students to find a connection and bonds through, meeting other people who are open about their depression or suicidal idealization or self-harm, and kind of get support around that as well, that nothing has to be hidden. And the more that we get to know that we're not alone out there, I think the safer we all are. So next slide, please. So, for so long we did things anecdotally, and we could talk about individual schools, and schools are so small, it's hard for me to kind of collect, I think, meaningful data because of our size. And plus, I'm not a researcher, and I don't pretend to be one. But thankfully, back in 2017, Andrew Finch and Tanner Smith, and there's a big research project done, kind of tracking students who are coming out of treatment, if they went back to their traditional school, went to another school that wasn't recovery school, or if they went to recovery high school. And what we found out, compared to students to non-recovery high schools, we have higher graduation rates, lower absenteeism. I mean, most of my students have truancy issues in the past, but this past quarter, we had over 92% daily attendance. So these are schools that students want to be at, and they do show up at. We have significant lower dropout rates. Most of our students do come behind in credit. We know that substance misuse and mental health oftentimes get in the way of adequate progress towards graduation. But when they get instilled a sense of hope and kind of see that they are making progress, are experiencing success, it might take them a little bit longer to graduate, but most of them stick around for that extra half year or other year. So we really do reduce dropout rates. More likely to abstain from using substances. We have fewer days using. And at Pease Academy, 82.5% of our students in 2021 stayed engaged in their recovery. And what I can say, because I just crunched the data for this year, I don't know why there's such a gap. I just threw that out there. Maybe it's as meaningful I had. But we had 81.75% of our students this year stay engaged in their recovery. That does not mean they didn't experience a reoccurrence of their in use, but we were able to provide the supports that they needed to get back on track and continue to stay engaged. about 10% of that body number had to get we helped them get additional treatment because that's what they wanted, and so they could, and then they returned to us. And really, I think about 8% of the students that that we did serve this year chose to return to use. Which is okay, right? That is a choice. It's certainly not judgmental, but we have to protect the space that we are. And so my hope is that they make their way back, but we help transition them back to a school that's better, a better fit for them during that time, and also help to support the parents as well. Next slide, please. So these are just a little bit some quotes on like, some students who kind of what they think, and it's amazing the feedback we get. So without P's, I would not be able to be in college. Without P's, I wouldn't be able to get through high school. Without P's, I'm not sure would be even alive today. But because everything P's gave me today, I can live my life to the fullest, happy and chemical free, and for that I'm truly grateful. Today happens to be our graduation, and we'll be graduating 9 students, and it's really an amazing time, because the families who are in the audience never really thought that they would see this day. Most of the students on the stage really didn't think they would see this day. Some of them didn't even think they'd be alive. I know our families live in fear. Are they going to get that phone call? And so today, tonight there'll be a lot of tears and tears of gratitude. And what I can say is each and every student who's graduating, all 9 of them, have applied to, been accepted to, and ready to enroll in a post-secondary program in the fall. Some of it's 4-year colleges, some of it's specific job training. We have a student who's going to go to Aveda to become a cosmetologist, and so whatever the students want to become, we can kind of help them get there. And also, some of these students are going to collegiate recovery programs, so that's another step in if they want to continue that ongoing kind of recovery supports at the college level as well. And we have a little over 200 collegiate recovery programs across the country, and you can see what the parents think of us. Is that it's not just a place where sober kids can get educated; it's a community of love and support and acceptance. I had to do a focus group a few years ago because my test scores weren't kind of where the state wanted them to be, because our students don't really care about things that don't matter in terms of their graduation and their grades. So, I mean, I'm not saying the test scores don't matter, but to them, they don't. And my parents were very clear, like, Mike, we're not really sure why we're talking about this. We're not sending our kids to you for high test scores. We're sending them to you so you can help save their lives. And what I would say, I set the table for them to save their own lives. So next slide, please. I know I'm rushing through this. I don't have a lot of time. So these are some different resources. Everybody has a copy of these slides, and you also have my contact. I think the Association of Recovery Schools is a wonderful place to start. We're a national organization that kind of helps support emerging schools to kind of get going, provide that technical assistance for those who are interested. Oftentimes, this year we've been partnering with peer recovery centers of excellence who can provide that kind of infrastructure to help better support technical assistance. There's a host of webinars we did them to how to kind of start recovery schools, the importance of collecting data, the importance of diversity, equity, and inclusion. And so that's another wonderful resource. And ARS also helps support those existing schools. And then there's Association of Recovery and Higher Education. We're actually doing a joint conference with ARS and ARHE at the end of June into early July out in San Diego. And it's a wonderful conference. And we're also partnering with alternative peer groups. Next slide, please. So that's me. I'm the director of Peace Academy, Peers Enjoying a Sober Education. I am a resource in the community. I field phone calls frequently nationally, not only because of my connection with ARS, but also because I've been doing this for as long as I have. And what I can say is, because I probably didn't do this in the introduction, is I am also a person in long-term recovery, and I wasn't really supposed to be in this job for as long as I was, as teaching, at least teaching. And what I really found to love about this job is not only did I not have to compartmentalize as much. I understand that this is not my recovery. I'm serving in a professional role, but to be able to watch these young people day in and day out make positive choices in their life, and sometimes make some unfortunate choices, but help hold themselves accountable and do what's right, the next right thing, is really kind of awe-inspiring. And so that's really kind of what's kept me around as long as I have, is really the students themselves. and just being able to provide them a safe space where they can find hope again. I know that I've like flown through stuff, talked super fast, but I am definitely open for questions or comments, and you can always contact me afterwards.
And folks can feel free to either use the raised hand feature on Zoom or throw your questions in the chat. I just want to say thank you so, so much, Michael, for being here. I appreciate everything that you've shared, and the intention in which you've shared it. I know, like, just at least for me in my experience, a lot of these like alternative education opportunities and like recovery schools and alternative high schools, again, at least from my experience in those in my world, a lot of times can be kind of through this lens of like shame and have this rigidity that isn't really honoring of the fluidity of the human experience, like I named in the chat, with recovery not being a linear thing, and that, if you relapse or, reconsider your relationship with substances, then that means that you're like back to the start or something, right? I just appreciate all the nuance that you shared too about the intention in which you bring into this work. I so deeply appreciate it. And again, absolutely welcome, not even just questions, but if anybody wants to highlight anything that was shared, any sort of realizations that they've come to today, anything is absolutely welcome in this space.
I appreciate that, Shane. And I know that some of these alternative schools are their schools of punishment. That their school of failure, like that you didn't make it in the regular school. And what I can say is that we really try to emphasize that we're a school of choice, and the students are choosing to come here. Sometimes it's grudgingly, but and I don't ever put any kind of long-term expectations on it. It's just whether or not they're kind of want to give it a try today and try to meet them where they are, and help them move forward, and sometimes they might decide that this isn't the right place, and sometimes it's for good reasons. We've had students, we're small, I can't offer everything that a student might have to offer. We had a young person in our school a couple of years ago who was a junior and they thrived, but we don't have a sophisticated dance program. Matter of fact, we have no dance program, and so we help transition them to the Purpose School of Arts, Performing Arts, and so their senior year they got to dance, and then move on to the next step. And so we sometimes be a short term stopping place. Sometimes it's the 4 years, and everything in between.
I love that though, and it all centers the young person's voice and choice, which is what uh, I believe is like a running trend, and hopefully like a motivational energy across this work and everybody involved with it, including folks in this space. So, and I do see you got some affirmation in the chat too. Your sincerity is genuine, says Melody, and I wholeheartedly agree with that and appreciate that too. So, and I see agency is so critical during this chapter of life, 100%. And this is a demographic of folks who don't often get that right and autonomy.
Yeah, and I'll just jump and say that we know that 9 out of 10 adults who have a diagnosed substance use disorder started when they were youth, and so often most of the resources are dedicated to the adult world. Even Minnesota, which has, I think, an embarrassment of riches when it comes to even adolescent support, it's still it's still minimal, and we're seeing things close down, and there's a lot of reasons for that. And I don't need to get into it, but I really do believe that if we really wanted to change the trajectory of this oftentimes very deadly disease, both in terms of substance misuse and mental health, we're waiting too long. And if we really kind of provided meaningful supports for our young people, then I think we could make a real dent in this. And the other part about it is, and I'll be honest, if they're not having fun, they're not going to stick around. And so a lot of what the recovery support we do, not only we try to make school, I mean, school is going to be school, and I'm one of those people who didn't like to go to school. And now here I am stuck in a school for 30 years. The universe has a fun way to smile at me. Anyways, try to provide fun activities at the school, keep it light, but also with accountability, but also have these alternative peer groups, these APGs, these after school programs where youth can interact with one another in positive, uplifting ways, and also have fun doing so.
I love that so much. And I almost missed it. There is a question. I see you, Kayla, in the chat, that says, I love the idea of this. What is the enrollment process like? and what kinds of strategies do you all use? I feel like you could
Um,
go
Yeah,
in a
so the
lot of different directions. Go
yeah,
ahead.
enrollment processes are gonna be different for each and every school. I really like to sit down with the incoming family, and kinda go over who we are, kind of, in terms of, academics, who we are, how we, provide the supports in the students, and kind of what our kind of expectations are, and then allow them to make the choice, is this the right school or not? If they think it's the right choice, we're open, and we're ready to go. It's a free public school. There are some private recovery schools, depending where they are, because one size model doesn't fit all. But all the private recovery schools that I know have very generous scholarships as well, to make sure that everybody who wants them needs them. Um, so that's kind of like really kind of the enrollment process for us. And there's paperwork and release of information and stuff like that. And then we gather all the information from all the different schools they went to and try to make some sense of it. We also serve students who have might come with special ed needs. So there's really no barriers for enrollment at Pease Academy and probably most of the other recovery high schools. The other part, let's see if I can find it again. There was a second part to that question. Technique. Oh, what kind of strategies do you all use? I think the strategies we use, and I'm not. You might want to clarify specifically what you're asking, maybe, but we start everything with what's used to be known as a relationship based education. That we start with kind of building a relationship with the youth, and we do so. We're not sober daycare or anything like that. We have classes, but if we can get students to trust us, and we trust the students, then we might get them to take some really healthy risks in terms of their educational practices, right? They might read for the first time because they know they're not going to be ridiculed or made fun of, and that it's a supportive environment. So I think relationship based education is really where we start. I also think being a restorative community is of utmost importance too. And again, that ties into that relationships as well. Those relationships as well is that we want to create a community where people feel a part of, that their voice is heard, and it's a safe space. And so when things do go awry or there are issues at the school, we're able to bring the community together and figure out what this next step should be. Or if someone has harmed the community, we have specific ways to address it. And it's not only students, but staff too can make missteps. And how can we restore the community that's in the classroom or the whole school if a teacher pops off one day because they're having a bad day. And so I think those are some of the. I mean, some of these other strategies. There's certainly definitely curricular strategies, and we have reading strategies to help kind of students do strategy. Um, when it comes to kind of the recovery supports, we don't follow a specific curriculum. We really just kind of just based on experience and knowledge, and letting the students guide us, and have them start looking at beyond just maybe substance use, but some of those old other behaviors that are troubling them or getting in the way of their success, or things like that, to help them get on board. I hope that answered the question or got to it a little bit.
And if you'd like, Kayla, I mean, not spotlight you. If you want to just affirm in the chat that was helpful and you're feeling like that question was answered, that's great. If you want to unmute and also share too and clarify or add anything that you'd like that kind of specifies your question more, you absolutely can. And I do see that you have some folks energized to collaborate in these efforts to enhance these types of supports and resources for folks
Yeah, yeah.
in this way too. So.
Yeah, and I see, I guess kind of lost, but kind of someone mentioned that it looks like Tandra, peer workers installed in more areas, so kind of that, that's one of my things that I've been working with more traditional schools to try to do, is to really to bring peer specialists into the schools. And the big reason why is because in the traditional schools or alternative schools, youth don't have safe space to talk about substance use. It's punitive, they feel judged. But if we can really bring in peers, because I think the peers are probably the best to do this, and to create space that allows our youth just to share openly and honestly about their experiences with it, and kind of even start setting goals around that. I think that's probably one of the best things we can do to help move them. And not every youth is going to want to be abstinent, right? And that's okay, but how can they, but they may not want to be, spending their whole day under the influence, and how, and how is it getting in the way, and things like that. So really, providing that peer space to provide that safe space where they're not feeling judged and they can get the supports they're looking for. I see Ashley has her hand up.
Hey there. This has been great, Michael. My question is kind of related to what you just talked about. I guess it's related to how people can advocate for, recovery schools in their community, because some people do see like, oh, a young person, is using substances and it's punitive or they need to be punished. Like, what advice would you give to help either policymakers or decision makers to advocate for recovery schools as an option? Yeah, any advice?
Yes, oftentimes it takes interested community members to have this idea, and then to try to find interested people within the school district, or at least a sympathetic ear. Frequently, it takes an administrator or administrators to talk to other administrators, and I say that because sometimes it's like someone will call me in and say, "Mike, can we have this idea, we want to present it, or we have presented it, and for whatever it might look like, but they're hesitant, they don't know, they want to see it in action." I really think a great way to kind of inform people about that. There's a movie done by Greg Williams called Generation Found, and it's specifically about adolescent recovery in the Houston area. I'm glad they did in Houston, not Minneapolis, because but it'd been difficult. But it really is a wonderful way to kind of show what recovery schools are and what they can do, and it kind of gets people on board. But if you can get a group of community members who are interested, I would say they should reach out to Association of Recovery Schools so we can provide letters of support or provide other specific kind of guidance in that, because that's kind of who we are and what we do. And then find that sympathetic ear in the traditional schools, because I think that's oftentimes the easiest way. And there's a lot of very effective models out there that different schools, depending on their structures, can implement. And then, I just saw something about the peers, or maybe it's the same thing. Sometimes schools are hesitant to have peer specialists in there because they're like, oh, are we condoning substance use? And so sometimes it takes, someone who's been in the field for 30 years to kind of say, the old ways don't work anymore. We have to provide these spaces, and if there and really we can create kind of lines of communication there if there's real worry and concern, because these are trained professionals, that they know the next steps to help this person get the help that they need, but it's not punitive. They're not going to get in trouble. It's like really kind of guided from them because they need something more, and we're just that conduit to there. But there's, yeah. I hope that helps, Ashley. And I hope if you are really interested, I'm not really interested, but if you are interested in exploring this more, please don't hesitate to reach out and ask. We can definitely connect you with different things to do. And there's a lot of people out there who are in the midst of being in emerging schools at different stages. And so I always like to, I've been doing this for 30 years. It's been pretty far removed, but to connecting with people a little bit closer to the startup is oftentimes helpful too.
That's really helpful. Thank you, Michael.
You're welcome. Oh, students stay at the school throughout the week. Are there boarding available? We have yet to. We when Peace first opened, we had a house to go along with it. Adolescent sober living has been done away with in Minnesota. And so with my relationships with some of the 18 plus recovery houses, a couple of them open their doors. It's a long-term goal of that nonprofit that we started to kind of open that back up. There is no sober boarding school yet, but there's an exciting model up in northern Maine, rural Maine, that is going to be probably opening fall of 25. That will be a boarding school model that I hope will be somewhat replicable across the country for those who need it or are thinking about it. So, a matter of fact, I just had a conversation, in-person conversation with a mom from the south of France, who is, yeah, we've gone international, who is looking for a recovery high school boarding school for her child, and they couldn't find one, and they're actually going to relocate to Minnesota, so their child can come here, which is to me is unbelievable, just because it really just shows, and the kid wants it. They know that returning to the school is just, yeah, they have too much at stake. and the parents are willing to, thankfully, have the flexibility to kind of make that move across the world.
And that says so much too, that folks are coming internationally and learning about you in that way too. I love that. And I mean, like I'm someone with firsthand lived experience in this area too. And I'm also someone who like went through public school throughout this entire journey. And just like this whole conversation has been almost like like a retroactive healing process for all the things that would have been super helpful for me and in a lot of different ways too. So I just so appreciate that these resources are available for folks now. And I love too that, you know, you're developing this boarding, like more residential format structure for these schools as well, but also just the fact that like folks are able to go to school and then go home and go to school, and like through your supports and things are able to have that, you know, still consistency day-to-day life without having that, you know, full separation from that day-to-day in their communities, and still having success and moving through their journeys of healing and forming those relationships, you know, with substances or moving beyond them, I think is awesome. So
Yeah.
awesome.
And I think most recovery schools, including us, we have to provide supports for the families as well. And it's not just the young person that we have, but it's also their families. And so how to provide them supports, because the youth are, making these monumental changes. But if they're going home to the kind of the same stuff, it becomes more increasingly difficult. Now we're clear that we're serving the student, but we also want to provide resources for the families as well.
I love that too. And that just deeply resonates with me as well. And folks just in my life, and I imagine other folks in this space resonate too with that, right? You know, the young people do all this work and then they go back to the same environment they were in with folks who were due to make changes too and didn't. And so, yeah, just balancing that. And yeah, I
Ashley,
see some
yeah,
affirmations too
Ashley,
with some
thank you for
content.
the trailer for Generation Found. So yeah, it's a good film, and it really gets people excited about recovery high schools.
I have another quick question. Hey, and Michael, I work with cars and intact, so I wanted to pop in and support this conversation today. It's been awesome. I know a lot of times with the different grantees that we work with, and SAMHSA in general, they're always asking about like, you know, they put funding behind what's evidence-based approaches, evidence-based this, evidence-based that. You know, I know you shared with some data with us today. Is that like the evidence-based, is this like an evidence-based approach? Like we could go to SAMHSA and say, this works, this is the evidence. Like, you know what I mean? Like the
Oh,
research and stuff.
absolutely. Actually, SAMHSA is in full support of recovery high schools, and they do see us as evidence-based practice, which is the best next step for youth who are coming out of treatment. And not only SAMHSA, but the Office of National Drug Control Policy, the White House office. I mean, so we are seen as that evidence-based practice, and that it's actually SAMHSA who's kind of who is insisting that kind of the peer recovery centers of excellence. I don't want to say insisted, but they say peer recovery centers of excellence needs to help provide recovery supports to the education. And so that's when they reached out to Recovery High School, ARS. So we are that evidence-based practice. And what I also say is that ARS is in the process of collecting a lot of data nationally, because like I said, our schools are relatively small. So school to school is tough, but we have the systematic evaluation of ARS, which both looks at the school as a whole, but also individual students. And we're compiling all this data for graduate students, researchers, and everybody to kind of dive into. And Jordan Jordinsky, that used to be a graduate student at Vanderbilt University under Dr. Andrew Finch, has now moved on to I can't remember, maybe Duke University, that might be off, but he's moved to somewhere tough, and he's going to be kind of taking on a role in developing research based on this data that we've been collecting for the last couple of years. So we'll have more information beyond just that original research project. Beyond that, before that, it was mostly again not anecdotal, but qualitative research based on stories, but we also know that people like numbers.
Yeah,
So
that's really helpful. I think that's helpful for the people that are here in the room today too, to hear like this is SAMHSA supported, because a lot of folks
SAMHSA loves us.
we work with, yeah, they're funded by SAMHSA. So it's good to hear like, yeah, SAMHSA is all for this. Advocate for this. Push for this in your community. Yeah, I love it.
Yeah, you can show them their policies, and they have Samson now has the Office of Recovery, and there are people embedded in the Office of Recovery who are some of our champions. So, and so if you need me to name drop in that any of that stuff to say, hey, you should get this person or that person, I'd be more than happy to connect people.
Awesome. Thanks, Michael.
You're welcome.
And I do see in the chat, I know that you mentioned obviously support to these young people, support to their caregivers, family members, right, as like two different parties. But I think this last question from Toya is like kind of bringing both parties together. If you have resources for family support or family therapy, so I'm thinking like the entire collective of folks involved in that young person's life, right? Is my thought.
You know, I would say that for the families we serve, the old model of Al-Anon and Nar-Anon just doesn't work. It's just, I mean, I'm not saying that it doesn't work, but overall, it's just not exactly what our families are looking for. There's some community partners that we have that I'm thinking of Thrive Family Recovery in Minnesota that follows the craft model. That kind of works with and I'm talking a little bit beyond my expertise, but some of those community partners at our site, you know, we provide monthly parent groups where they're going to be with a licensed therapist who kind of helps. They teach different skills. Each month that parents can take home. And we haven't yet, and I say yet because our Peace Community Foundation has been talking about how can we involve maybe the siblings as well, because they're part of the family structure, not to provide them supports, but that has been in our part of our conversations. But we have to, we want to get something done well, start something doing something well, and then move on kind of the next thing. Not that we're ignoring, but we just want to be purposeful as we kind of move forward. Some of the more established APGs, alternative peer groups, especially in like the Texas area, they do provide a pretty intensive family support and therapy for the entire, because these APGs have been in operation for 45 years, and they're not the schools, but they provide the support. So they have a lot of really cool, neat things. And I also do have a shout out to the school in Portland, Oregon, Lake Oswego, Harmony, because they are amazing when it comes to doing these community partnerships, and they have so many different ones. So they're really able to provide these true wraparound services for their entire school community, which includes parents, grandparents, siblings, you know, everybody that's part of that greater family structure. So it's neat.
Awesome. Thank you. And I see you again, Ashley, too. Did you have another question, Nathan, that you wanted to shout out? Okay, cool. I'm sorry. I just saw you on camera, so I just want to make sure I spotlight you if you wanted it. Awesome. And you got some appreciation in the chat too. Well, I want to give like one more little bit of grace and space for folks if they have any last minute questions, although we do have your contact information so folks can reach out beyond this session. But while we're here together, any other final questions, affirmations, highlights? All right. Oh, I see folks naming other similar resources as well. And imagine that folks might have in mind local high schools and other like similar relevant connections as well local to your area. And if you want to plug those in the chat, absolutely feel free to do so. And thank you, Tandra. I do see that you added something as well. So anyway, all that is to say, as we start moving into our closing items, I just want to thank you again, Michael, so much for being here. I'm glad to know that you're a person on the planet, never mind a person doing the wonderful work that you're doing. Yeah, grateful for you in this space and hoping to stay connected in the future. And folks, please, in this space, please feel free to reach out and stay connected with Michael. You are a wonderful resource to have, and we're absolutely a pleasure to have in this space as a presenter. So thank you again. And
Thank you.
Thank you. As we go to wrap up, y'all, just our regular kind of notes here. First and foremost, thank you for being here. We appreciate having you. I know we rescheduled this month due to a holiday on a regular date, so appreciate you being here. And as we named a little bit before, right, you will receive a certificate of completion for attending this session, as well as a slide deck and a copy of the recording of this webinar, which was recorded. And just in these last few moments, I want to make sure that folks have an opportunity if they want to, like if there are any events, opportunities, initiatives, projects that you want to spotlight, you can feel free to add those links and things in the chat. I know we don't have a whole bunch of time to have like a full conversation to spotlight all of our wonderful things that I'm sure we're doing in our work and roles, but if anybody wants to throw anything in the chat, absolutely feel free to do so. And I say that as well because I have something. So folks might be familiar with NTAC's podcasts. There are many, and there are different series and things. And there is a series called Tangled Roots, Stories Navigating Youth and Family Systems. And we are trying to recruit folks to be part of that podcast series. So I'm just gonna, I'm at my word limit. I'm gonna drop as much as I can in the chat and then the rest of it in a message after. For folks who would like to take that and share it out, we are looking for folks there. Appreciate the gratitude in the chat. And again, like if you have links, blurbs with a link or a contact person to reach out to, if you're interested for anything going on, and you'd like to share that in this space, absolutely feel free. And then otherwise, as always, your feedback is important to us. You will receive a little evaluation feedback survey. Please, please, please be transparent and share your thoughts with us. We want this to be a living, breathing virtual space, and we want to continue ensuring that we bring folks and involve topics that are relevant to the work that you do. So please let us know. And as always, stay connected with us across social media, right? And I will just let folks know that we do not have a YYASS session in July. So I will see y'all again for, I believe, our regularly scheduled time and date of the month in August. So, yeah, there's a big important meeting happening in July. So unfortunately, I will be traveling to that. So no, YYASS, but hopefully folks will build up some energy and momentum and excitement for returning in August. Oh, and appreciate you, Tandra. I'll miss y'all. And we shared the NTAC website at the beginning of the session, right? But we have our contact info too if folks want to reach out to request TA, to download the flyer for NTAC in general, right? Visit our website. So with all of that, I appreciate each and every one of you. And if anybody does want to take a moment, we do have 5 minutes. You can feel free to raise your hand, come off mute, and spotlight anything you got going on in your working world that you'd like to share with this group. And otherwise, appreciate your time, and folks can absolutely feel free to take off, unless Ashley or Michael, you have anything that you want to close out with before we let folks on to the rest of their days. All right, y'all. Thanks so much.
Thanks, Shane.